Patients that have never been to the chiropractor before are usually surprised at how much better they feel. So what we'll do is we'll just kind of take a general approach and take a look at your whole spine from your neck all the way down to your low back and your hips. And we'll just see how well you're moving. We'll take a look at how your spine is moving individually, and we'll just go ahead and get you adjusted anywhere that you need to be adjusted. And we'll go from there. Because you said you're not in like a ton of pain, it's more so just like a lot of stiffness and discomfort.
Yeah, it's like, you know, like a dull ache. Like it's not like, I mean, I still go on with that with like my day, but it's like, you know, when I wake up sometimes in the morning, I'm just like, oh my God.
Yeah. So let's just kind of start by seeing how well you're moving. So we'll have you sit up tall for me. You're gonna bring your chin down to your chest as far as you can. If you can touch your chin to your chest, try. Good. And then look up backwards to the ceiling. Okay, come back to the center. Look over your right shoulder as far as you can. Good. Is that as far as you can go turning your head? Okay, and then the other side. Okay, so we're a little stiff with our turning. Nothing too crazy. Looks like we might be turning a little bit better to the right than we are to the left. You'll reach down, touch your toes as far as you can. Okay, not too bad. And then we'll have you bend backwards. Yeah, well, don't do like a back bend, but just kind of go backwards as far as you can. Okay, good. So, not too bad there either. We'll have you go face down. Your face will go right here where the paper is. And then there's a little handle right there by my foot that you can grab onto. Perfect. I'll have you scoot down just a hair. Good. Nothing too crazy. We're a little tight up there in the ribs. And a little bit right here in that low back too. Okay, start here. So my hand's gonna go here. I'm gonna give your head a little turn. You'll just keep your neck loose. I'll do all the work, okay? So we're gonna go here. Good. Okay, how we feel?
Good.
Yeah?
That was intense.
Yeah. A little surprising?
Yeah.
Okay, I'm gonna go here. Good. One more. Perfect. Okay. Good. All your air out, loose shoulders, little push. Perfect. And again. Out. Okay, a little tough on that one, so we might do that one from face up. Or maybe we'll go and a little push from this hand. So, perfect. Okay. That's okay in those ribs? Mm-hmm. Good. All right, same thing over here. A little pull from this hand, little push over here. Good. Awesome. Doing all right so far?
Yeah.
Good. And let's have you scoot up towards me just a bit. Good. Okay. So we'll walk you through this one. Yeah. You feel that?
Oh, yeah.
Tender? Yeah. Okay, so I'm going to lift you up, and then just let me have all the way to that head, just kind of like you're going to sleep on my palm here. Perfect. So it's going to be fast, but it's not going to hurt, okay? So nice and easy, let that head fall. Good. I gotcha. Good. Not too crazy, right? One more here. Good. Let that head fall down to the table. Beautiful. How we feel?
Good.
Good.
I mean, yeah.
A little surprising. So we're doing a little decompression with your neck here, okay? This one looks way scarier than it is. So let's have you lift that head up. Good, and then set it down. No pain, right? Mm-hmm. Okay, so we're gonna give you a little decompression pull. Nothing too wild. Deep breath in, out, loose, loose, loose. Good. And that just helps to open everything up. Back now, so we'll have you roll onto your side, kind of like you're laying on this shoulder. And I'm gonna lift this up so that your head can rest there. Perfect. Top leg will be bent. Perfect. And then we're gonna go right here. This one goes on your belly. Oh, deep breath in, out, loose belly. Good. Take a second. Feeling okay?
Yeah.
Good. Okay, let's roll over to the other side. Perfect. Okay. Bottom leg will be straight. Top leg will be bent. Good. I'm gonna go right here. This one overhead. Perfect. Not bad.
Yeah, that's fine.
Okay, so let's have you hop up. We'll take a look at a few of those movements again and see how everything feels. Okay, let's have you do your toe touch. Good. And then come on up, bend backwards. Good. How's that feel?
Good.
Good.
Yeah.
And then we'll have you have a seat. Yeah. And then your left. Good. And how's that kind of neck and upper back feel?
That's good, because I know when I did it first and you're like, is that the farthest? Like,
Yeah.
I felt this strain, so it was like, okay, like I'm exerting,
Yeah.
like having to go, so that was more smoother.
Yeah.
Yeah.
And we don't want you working super hard just to look over your shoulder.
Yeah.
So.
I guess I never noticed that. I guess I'm like looking
Yeah.
over my shoulder that often to be like, oh, that's not normal.
Yeah.
Yeah.
So how's that upper back and everything feel?
It feels good.
Good.
Yeah.
And we got really great releases through all your ribs and everything up there. How do we feel about our first chiropractic experience?
I think it was good. Like, just comparing it to, I guess, the stereotypical, like, oh, it's the same as going to, like, a masseuse, or, you know, I think just the points that you were able to, like, hit, that's not something I could just do, like, oh, with, like, my morning stretching, or just, like, having someone, like, you know, like, the bear hug,
Yeah.
or, like, pick you up and pop your back like that. Like, I've done, I guess, all those, like, small, like, short-term, like, you know, whatever people have done, but this was, like, crazy.
Yeah.
No.
But, you know, that's kind of what we're trained to do as chiropractors, is go in there and find those joints that need to move the most
Mhm.
and get in there and specifically target them and open them up. That way you can kind of have more even movement throughout all the regions of your spine. So.
No, I totally agree, because I also, like, go to the gym and stuff like that, so now I've, like, become more educated on, like, yeah, I wasn't, like, a really big person who would, like, stretch after my workouts or this or that, but it's, like, eventually that is going to take a toll
Yeah.
on my body, and it's not something that I can be like, oh, like, yeah, I can fix that on my own. Like,
Yeah.
I am going to need someone who, that is what their specialty, that's their
Right.
niche, right? It's not,
Yeah.
like, I'm just going to end up hurting myself.
Especially as we start to get older, like the self-care becomes more and more important.
Yes, and
So.
I think that's kind of one other thing. I was like, okay, well, if I'm like my body's rusty, but I'm pushing it at its, like, max at the gym, something's not gonna add up.
Yeah.
So that's why I wanted to really introduce this, and I, like, kind of did my homework. I, like, ended up finding you on TikTok, actually.
Oh, yeah,
Yeah.
perfect.
So I was like, okay, because I was like, I don't know if I want to just, like, you know, go to anybody, like,
Yeah.
you know, just, like, the first chiropractor place I see. So I did, like, my homework, and I thought it was like, okay, like, I feel kind of comfortable, because I think the videos are kind of intense, and, like,
Yeah.
I think it's just, like, the
It can
noises,
seem like
yeah.
a lot. Yeah.
And, like, even when I was, like, sitting, I was like, okay, like, I don't need to be scared, but it's just kind of in the back of your head.
Yeah.
So
Was it like you thought it would be? Was it like you expected, or not as bad?
I want to say, like, 50-50. I didn't think, like, some of, like, I guess the sounds I heard, like, I don't think I was expecting it to that level. I think it was,
Yeah.
like, that one hip one. That one was, like, that was intense.
That first one, yeah.
Yeah, that was, like, okay, that one. Yeah, I think that's what maybe sold me on all of this. Like, okay, yeah, there's no way. I don't think anything, like, I've done previously would have brought that kind of relief.
Yeah.
So.
Yeah.
Yeah, it was good.
Good. Well, I'm glad we were able to help you today. I'm glad you chose to come in. You know, I don't feel anything too crazy going on with you. Your spine feels healthy. It feels like you're moving fairly well.
Okay.
Definitely just the normal amount of stiffness that I would expect for someone who's never been to the chiropractor.
Okay.
So for you, really anywhere between once to twice a month is probably going to be a good frequency for you, just depending on how stiff or how tight you're feeling. Might be a good idea to see you again in like 2, maybe 3 weeks.
Okay.
And then from there, we can start kind of seeing if you can do like once a month and that doesn't bother you. So
Yeah.
as far as you can. Okay, and then look up to the ceiling back as far as you can. Okay, look over your left shoulder as far as you can, and your right. Okay, not too bad. Let's see how it feels. A little stuck right there. And right there. Okay. A little tightness through the ribs, nothing too crazy.
Yeah, I got a lot of rib pain.
Through that hip too, I can feel
Yeah.
that. Okay, so we'll start with your neck and then we'll kind of work our way around. So I'm gonna hop up here. Go ahead and just lean back on my leg. I'm gonna tilt you a little bit. Good. Doing okay?
Yeah.
Over here. Good. All right, how's that feel?
Good.
Better?
Yeah.
Good. Okay.
Different type of crunch.
Yeah, a little bit of a wild one that one is, right?
Yeah.
And you'll scoot down a bit for me. Perfect. Okay, we're gonna cross these arms. Big breath in. Out. Okay, tight there. One more. There we go. Okay, that was a good one. And let's have you go face down.
Face down.
See if we can get a little bit of a better release on that upper back. Good. So we'll go right here with your arms off the sides. Perfect. Big breath in. Out. Okay. And you're super locked up right there.
Mm-hmm.
We'll probably decompress you, but we'll probably do that at the end as well. Okay. So I'm going to put my hand under your hip here, and then just let your stomach be relaxed. A little push. Okay, nothing too crazy there. Same thing on this side. Okay, nothing too crazy there. Good. Right here and right there. Okay. Good. That was a good one.
Yeah.
Okay, and then this side. Perfect. And this is the one that was bothering you.
Mm-hmm.
Good. Okay, good one there. And then we'll do your hips. So we'll have you just put that leg straight. Perfect. Good. Good. Okay. Feeling all right there?
Yeah.
Cool. And let's have you scoot way up towards the top here. You'll just put your head on this pillow. So let's have you open, close. Yeah, I feel that clicking and popping. Open, close. Okay. Yeah. My jaw's doing tricks. So
It does
okay.
a lot of things.
I'm gonna lay to the side. Now you're gonna have your teeth apart, loose as you can. Good. Okay. Doing all right?
Yeah, it's fine.
We'll do the other side. Good. Okay. A little bit. You think you can handle another one?
Yeah.
Okay. We're gonna try this a little differently. You go right here. Good. Loose as you can. There it is. Okay, last one. Good. Okay. You're a tough cookie.
Yeah.
How does that feel with the jaw?
Better.
Better? Yeah, the
Yeah.
clicking and popping is something that it takes a while for that to go away, like consistent
Right.
treatments.
Mm-hmm.
But we can still get you some relief from the pain. And then let's decompress it a little bit. So lift that head up for me. And then just set it down. Good. Okay. Big breath in. Out.
Is that kind of similar to like the white
Yes.
strap?
Yeah.
Okay.
I like to do it with the towel so that my fingers are still touching you.
Yeah.
So I can feel the tension in your neck. But
Mhm.
it's pretty much the same as the Y strap.
Yeah. Okay.
Have you had the Y strap before?
No, I've never wanted that.
Oh.
I've always been like scared of it. I've always been really intimidated.
Oh, I'm sorry I didn't warn you.
No, it's fine. It's fine. It wasn't bad at all. I felt really good. I felt the difference in the adjustment of where
Yes.
like it got. Yeah.
Yeah, it kind of opened up that area that was really
Mhm.
compressed that we tried to do from face up and from face down.
Yeah.
Kind of open that stuff up.
Mhm.
So, okay, well, let's have you sit up again. Let's have you bring that chin down to your chest again. Okay, and then look up to the ceiling back. Okay, look over your left shoulder and your right. Good. And how does everything feel to you? A little bit about it.
So I like did something probably several years ago to where it was like a nagging pain, probably when I was like in PT school, like circa 2014.
Yeah.
So, but it was just an annoyance at that point. So eventually I kind of like got that under control, chiropractic, PT, all things. And then it was almost like 2 years ago. Literally was not doing anything. I was on vacation. I came back from vacation and one day I literally just woke up. I was like, wow, my right low back really hurts.
Yeah.
Like more than an annoyance, like I just felt like I needed to be adjusted. Is how I can describe it. Like something was not feeling right.
Yeah.
I did all the same things, chiro, PT, everything, and it honestly just kept getting worse for about 5 months to the point where I like, against my better judgment, like went and got like an MRI, met with the doctor, and they recommended like a rhizotomy. I was like, no, thank you.
Yeah.
So nobody was like, okay, back to square one.
Most of it's around the right SI joint?
Yes, right SI joint. I used to get like radicular stuff, but it was mostly on the left side.
Okay. Was the pain, when you were having the left-sided radicular symptoms, was the pain still on the right side of your low back?
Yes.
Okay, interesting.
Yeah.
And it's not feeling weak or anything, like neurologically weak?
No, nothing.
Okay.
No, nothing like
Yeah.
that. Yeah.
So how would you describe the symptoms in the SI joint? Is it sharp, burning, achy, tired?
Aching and occasionally a little bit of maybe like a sharp thing, but that's definitely more in the past. So right now it's just like this annoying
Kind of
ache,
constant.
just something doesn't quite feel right.
Okay. And then the neck and the upper back, there's just kind of just general stiffness, tightness.
Chest
Okay.
tightness, like, all that stuff. Long commute, all of it.
Yeah. Okay. Well, since you are a PT and you kind of know how all this goes and you've done a very good job of explaining everything, we'll just kind of see how well you're moving.
Okay.
We'll go through and see what's going on and kind of start from there. How long ago was your last adjustment?
Probably sometime over the summer, June, July.
Okay, so let's do this. Let's just start by looking at the neck and then we'll go everywhere else. So sit up tall for me. You're gonna bring your chin down to your chest as far as you can. Okay, and then look up back to the ceiling as far as you can. Okay, and then look over your right shoulder and your left. Okay, not terrible. We're a little reduced in rotation and flexion, but your extension and everything looks okay. Nothing felt like particularly painful there?
No.
Okay, and let's have you stand up for me. You're gonna reach down, touch your toes as far as you can. Okay, good there. And then come on up and bend backwards into extension and kind of press forward on the SI joint. Okay, nice little self-manipulation there. Was any of that painful or that felt okay?
It felt okay.
Okay. So our range looks good. So that tells me that globally you're fine, but segmentally we gotta see what's going on. So let's do this. Let's have you go face down. Your face will go in the crack. Okay, and then you just hang your arms off the sides. Perfect. Okay. Now if I press into the SI joint, is that painful?
Not like painful, but I definitely, it doesn't feel good.
Yeah, it feels quite stuck.
Yeah.
Not as bad as this side. A little bit going on right here. Right up here too.
Oh yeah, my left shoulder blade is kind of a mess.
Yeah, I can feel that. Okay, so I definitely want to get in there. And let's have you lay on your back for me. Yeah, we got some upper cervical stuff going on too.
Very tender.
Yeah. Okay, so let's start to work through some of this. So I'll have you sit up for me. We're going to start with some seated upper cervical stuff. Yeah. That popped already a little bit.
It's ready.
Okay, so we're going to get in here and start to open some of this up.
Okay.
So my hand's going to go right here. I'm going to turn you a little bit. Good. You're doing okay right there? Okay, let the shoulder relax. Perfect.
Whoa.
Okay. How do we feel there?
Good.
Feel okay?
Yeah.
All right. We're going to come into this side.
Okay.
Good. little. There we go.
Oh my gosh. That's wild.
Both okay?
Yeah.
All right. So now let's get into kind of the rest of this. So that left shoulder blade, we're gonna do next, the ribs in that area.
Okay.
So go ahead and lay on your back for me.
Mhm.
And scoot down just a little from where you are. Perfect. This hand is gonna go on your collarbone.
Okay.
And then this hand, go right there, sorry for being picky.
Okay.
This hand's gonna reach down my back as if you're
Okay.
gonna try and grab the top of my pants.
Okay.
So you're kind of just giving me a little hug here.
Okay.
Good. And then relax your whole arm and shoulder blade. Yeah, right in there. Okay. Deep breath in. Out. Loose.
Oh my gosh.
Okay. How'd that feel?
Good.
Good. A little crazy, huh?
Like it's been there for ages, but I needed that to happen.
Yeah, those ribs were stuck.
Yeah.
So, okay. And now we're going to come into the mid-thoracics. Breathe in. Out. Good. Loose shoulders. There we go. Okay. Not too crazy there.
Yeah.
So let's get that SI joint so it's on the right side. So go ahead and lay that way. Got a little spooky pillow for you here. Okay, so we're gonna hit the sacrum here. I'm gonna pull it off that shoulder. This one's gonna go overhead. Is that okay there?
Mhm.
Okay, I'm gonna bring your hip forward a bit.
Okay.
Right there. Okay, so yeah. Deep breath in. Out. Good. Perfect. That feel okay for you?
Uh-huh. Yeah.
And then let's go to the other side. Bring that bottom hip forward a bit.
Mhm.
Perfect. And then we're gonna go this one overhead.
Yep.
And this one right here. Perfect. This one's gonna be more for the lumbar spine.
Okay.
Breathe in. Out. Good. Loose belly. There we go. Okay. And we'll have you lay flat.
Okay.
Doing okay so far?
Yeah.
Okay, we're gonna get these hips.
Okay.
And let this one go flat. Perfect. Loose. Good. That's okay?
Yeah.
Alright, right here. Good. Okay,
Cool.
let's set you up and see how everything feels.
Okay.
And we'll have you repeat a few of those motions. So let's go for your toe touch again.
Mhm.
Good. And then your back bend. Good. And how's that feel compared to before?
Yeah, I felt like I had a limit before, and now it's like free.
Yeah.
So I
Just
was
bend right on over backwards.
Yeah, just like flip over. Yeah.
And then let's have you have a seat. Let's take a look at your neck. So we'll go chin down to your chest. Good. And then look up to the ceiling. And then over your right shoulder. And over your left. Good. And how's that feel?
Good.
Good.
A lot of reduced tension.
Yeah.
Yeah.
And the shoulder blade area that was kind of bothering you?
Yeah, it feels way better.
Yeah. That was a huge release through those ribs.
Yeah,
So.
that's crazy.
Yeah. So you just had a couple of those areas that were just really stuck. You know, those joints get bound up.
Yes.
Yeah. The SI joint on the right side, it was probably the worst out of all of them in terms of like its actual ability to move when I'm challenging the joint.
Yeah.
So that might take a little bit of like repeated visits to kind of work on that to really open that up all the way.
Okay.
But everything moved pretty well for us today. So
Okay.
I think that always like your prognosis is good.
Yeah.
So, and I didn't feel, obviously I don't have x-ray vision, but I didn't feel any crazy like arthritis or degeneration or anything that would give me cause for alarm when it comes to your spine. So
Right.
pretty much all your joints are moving healthy. And so
Yeah.
I think if we could just clean up that SI joint and kind of break you from that pattern onto. Perfect. Is that comfortable for you?
That's fine.
Okay. A little stiff right here in the middle of your back. Up here on this right side as well. Any pain there?
Oh no.
Okay. What about here?
Yes.
Okay. Is this a little bit sharp?
It just feels like it needs to be
Yeah.
popped. I don't know.
It does. Okay. So yeah, basically your tailbone is just real jammed up here. This joint between your ilium and your sacrum, especially on the left, a little bit on the right. So we'll address that.
I'm gonna try to not be tense. Okay.
We're going to probably adjust most of this from face up. A little stiff there too, for sure. Okay. Let's have you lay on your back for me. And we'll take a look at your neck. Yeah, oof, right there. Is that tender when I press there? Yeah, okay. Yeah, all through there.
Ew, yeah.
Not fun, huh? Right there too, okay. All right, so we're gonna start with your neck, and then we'll do your mid-back, and we'll come down and do your, did you say fuck? That's okay.
Oh, no, I forgot.
No, you can curse. Yeah, you just wave hi to YouTube, it's okay. We're all adults.
When I did have this done, I swallowed my gum when he did the one side.
Oh,
I was
no.
Like, I don't want to do that one.
Yeah, I always have people spit out their gum. You don't have gum in, do you?
No, I took it out.
Okay, all right. So we'll walk you through it nice and easy, okay?
Okay.
So. Good. All right, we're gonna come in right here. I'm gonna lift you up and just let me have all the weight of that head. Perfect. It's gonna be fast, but it's not gonna hurt, okay?
Okay. It's good. Oh, man.
How we feel?
Good.
A little surprising, huh?
Yes, but it was good.
Yeah.
It didn't hurt. I knew I was going to tense up, but I didn't. Okay.
Yeah. Most people describe it just as kind of like overwhelming and surprising. Okay. Doing great.
I think I tensed up.
Oh, you did great.
Okay.
Yeah, we got everything we needed there. Still doing good?
Yes.
Okay.
I feel like the worst part's over.
Yeah, or at least the most anxiety-inducing part for most people. Yeah.
All right, I'm good.
Okay, I'm gonna scoot you down a little bit.
Like it up?
Yeah, right there. And then we'll have you lay back again.
All right.
Perfect. Okay, so now we're gonna do your mid-back. I'm gonna cross your arms here, just like that. I'm gonna roll you. My hand's gonna go underneath you. And I'm gonna kind of smush you. Okay. So we're gonna roll you here. I'll have you take a deep breath in. Exhale, blow it all the way out. Loose shoulders. Good. And again. Good. Felt nice?
Yes.
Now we're gonna get that hip, okay? So you're gonna roll on your side, you're gonna face me over here. Your head will go on this like a little pillow. Perfect. Your bottom leg is gonna be straight. Top leg is gonna be bent. Just like that. I'm gonna pull you off this arm just a little bit. Oh yeah, you did a number on yourself there, huh?
Oh yeah, pretty good one on my leg too
Yeah.
from the graft.
Okay. So, right there. Let's have you take a deep breath in. Out.
Oh shoot. Am I?
Yeah, you're okay. We'll do one more. Deep breath in. Out. Perfect.
Okay.
Other side. Good. Right here and here. Perfect. Pull you off that arm a little bit. And this arm will go overhead. Bring that bottom hip forward slightly for me. There we go. Okay. Breathe in. Out. Good. Awesome. How do we feel about that? Good. Pretty big release there.
Good. Yeah.
Yeah. Okay, lay flat on your back for me. We're going to take a look at your actual hip joints and your knees. So, let's see here. Everything relaxed here? Yeah, not terrible. We're a little limited on internal rotation, but not bad there. Let's see what's going on this side. Yeah, doing pretty good. A little bit limited on external here. You feel
Oh,
like
really?
that
Okay.
pinching?
I feel more when we go inside. I feel it right here,
Feel
like
this.
way more than on this side.
Gotcha. Okay, we're going to clear this joint up a little bit. So just relax that whole leg as much as you can. I'm going to give you a little pull. Good. One more. There we go. Good. All right. And then we'll go this side. Good. A little bit of a better release on the hip on this side compared to this side. So that one's a little bit stuck. And let's have you scoot up again for me. Perfect. Now we're going to take a look at those hip flexors. I'll have you put your hands right here kind of on your belly. Good. I'm going to lift this knee up here. And my thumb's going to go on the inside of your hip for your hip flexor, okay? So, a little tender there.
Yes.
Yeah.
Mhm.
Yeah, okay. We're gonna go right there. That okay?
Yeah, it feels like extremely tight.
Okay, but not sharp,
No.
just kind of dull. So what we're gonna do, I'm gonna give this hip back to you. So you're gonna hold your leg up, okay?
Okay.
Not with your hands, you're just gonna hold it up with your own power. And then what's gonna happen is you're gonna lower your leg down to the table all the way till it's straight.
Right now?
Mm-hmm.
Slowly?
Yep. Good. Okay, come on back up. Good. And slowly lower. Doing great. One more. Bring it up. And we're gonna go right there and slowly lower. Good. You hear
did
that
you-
little opening up?
Okay, but did you also feel, I don't know, do you feel like the cracking in the
Yeah,
back a little
I
bit?
felt the crunching, cracking. Okay.
Feeling good. It's feeling really good.
I'm gonna come up here. If you bring those hands back onto your belly, perfect. Right there.
Yes.
Yeah.
This one almost hurts worse.
Having fun yet?
Last.
Slowly lower that leg down.
Sorry.
You're fine. Good. Come on back up. And slowly lower. Good. Come on back up. And slowly lower. Just a little bit of participation today. Okay, now we'll stretch that out real quick and then we'll have you hop up. So let's go face down. Okay. Good. I'm gonna go right here. I'm gonna lift this up. Decent stretch. Yeah. Okay, now I want you to pull your knee down to the table. Okay, so pull. 5, 4, 3, 2, 1. Relax. Good. And pull. 5, 4, 3, 2, 1. Relax. Come up a little bit. Last one. Pull down. 5, 4, 3, 2, 1. Relax. Perfect. Doing all right? Okay. A little better on this side from baseline, yeah. And pull the knee. 5, 4, 3, 2, 1. Relax. Good. And again, pull down. 5, 4, 3, 2, 1. Relax. Good. Last one. 5, 4, 3, 2, 1. Relax. Good. Okay. Kind of put you through your paces there a little bit. Let's have you hop up and we'll see how everything feels. First of all, how we feel just standing up.
I mean, good. Like, everything feels really loose. I mean, definitely still having, like, tightness right here, but I didn't expect it to be a miracle today.
Yeah.
So,
Something that we're going to keep working through with you.
Mhm.
As long as you feel more open, feel like you can move better.
Yeah.
Yeah.
And I didn't know I really had a problem up here.
Yeah, yeah.
No, that was
Especially in
really
that mid back was very tight.
Okay.
So let's have you face that way. We'll do your toe touch. Good. Looks good. And then come on up, bend backwards. Now this one was getting you earlier, so let's see how this feels.
It feels better.
Good.
Feels better.
Okay.
Still
Still a
definitely
little
still
bit there.
feels better.
Okay. Let's have you have a seat for me. You'll sit up tall and then bring your chin down to your chest. Good. Look up to the ceiling. Better there. And then let's have you look over the right shoulder and the left. Looks like you're going a little further there too. Good. Okay. So what do you think of your first chiropractic experience in like 7-8 years?
Yeah, it was fine.
Good.
It was fine.
Good.
It wasn't as scary as what I was thinking it was gonna be.
Yeah. A lot of people are just terrified of the neck, and it's not that big a deal once you feel it.
I'm really glad we started there.
Yeah.
Because everything else afterwards.
It's all downhill from there. I tend to start at the neck.
Allora, mi sono operata al crociato.
Sì, lo vedo, e non in artroscopia.
Sì, hanno preso il rotulio e poi hanno fatto pure l'aperoscopia.
Ok.
E poi
Artroscopia.
artroscopia e poi hanno preso... Mi fa male l'anca.
L'anca destra.
Sì, l'anca destra mi scrocchia.
Scrocchia? Davanti di
Qua.
fianco, ok. Quando cammini, quando corri,
Quando alzo la gamba e la ributto giù.
Ok,
Quando la piego praticamente.
perfetto. Il ginocchio adesso come sta?
Il ginocchio sta bene, anche perché mi sono operata 12 anni fa.
Ok,
Però comunque con il cambio di temperature e cose il ginocchio mi fa male.
ok. Quindi senti quando cambia il tempo.
Esatto, e poi tendenzialmente sforzo più quest'altro ginocchio.
Che è il motivo per cui secondo me ti scrocchia l'anca.
Esatto, e quindi mi fa malissimo quest'altro ginocchio
Bene.
quando sforzo troppo.
Allora faccio una piccola osservazione per vedere come sei messa. Sì, un po' più alto lì. Allora, adesso toccherò dei punti che potrebbero darti un po' fastidio. Qui secondo me
Sì,
fa più male che dall'altra parte.
esatto.
Se vengo su, dove è peggio? Sempre sinistra?
Sì,
Ok. Nel mezzo invece dovrebbe essere peggio di qua e qua un po' meno?
sì,
Ok.
mi fa male.
E di qua meno?
Sì,
Allora dimmi una cosa Elisa, quando io qua schiaccio,
sì,
migliora questo?
sì,
Se lascio andare?
mi fa male.
Perfetto. Sdraiata a pancia in aria. Rilassata. Ok, questa gamba appare un po' più corta di questa. Mi sarei aspettato il contrario a dire il vero, ma vediamo se ho visto bene o meno. Fastidio qua? O è
Non
peggio
tantissimo. Di qua,
Ok,
destra.
allora ho visto bene. Sull'esterno dovrebbe essere il peggio di qua e qua meno.
Esatto.
Sul bacino dovresti aver fastidio qua,
Sì,
qua meno.
esatto.
Risalendo dovresti averne più qua, qua meno.
Sì,
Ok, ci torna. Testiamo un po', cominciamo con l'anca, testiamo un po' i muscoli. Tieni il ginocchio dritto, spingi la gamba su verso il soffitto, vai. Retto del femore funziona. Tieni la gamba qua, spingi su verso... Aspetta, vai, spingi. Psoas funziona. Ruota la gamba internamente senza fare questo.
ok.
Vai. Vai. Non funziona? Questo è il piriforme, un muscolo che dovrebbe ruotare esternamente la gamba. Vediamo se dall'altra parte è attivo. Spingi in dentro contro di me. Più forte di qua.
Sì.
Sei d'accordo?
Sì,
Di qua invece proprio...
niente.
Vai. Niente. C'è un punto sul pube. Fa male?
Sì,
Ti chiedo scusa. 5, 4, 3, 2, 1. Perfetto. Piega tutte e due le gambe. Spingi le ginocchia uno contro l'altro. Ok, vieni giù. Sì, ti chiedo scusa. Perdonami,
nulla.
1. Sono sul pub, Vediamo se abbiamo riattivato il muscolo. Spingi in dentro. No, così.
Ah sì,
Vai. Come lo senti?
meglio.
Ok. Cosa succede? Quando quel muscolo si indebolisce, il suo antagonista che invece fa la rotazione interna dell'anca, quindi questo movimento qua, prende il sopravvento, ok? Diventa ipertonico. E questo muscolo che è diventato ipertonico, del quale sto parlando, è lo psoas che ti ho testato prima, quello che ti ho fatto spingere così, ok? Quindi ti chiedo di sbottonare un pochino che vado ad allentare. Ok. Qui avrei un po' di fastidio, Perdonami. Lascia a me la gamba, la muovo io.
Ok.
Gestibile?
Sì,
La peculiarità della kinesiologia applicata, quando ci lavoro, è che per risolvere un problema non rintraccia il muscolo contratto, ma rintraccia il muscolo debole, che poi ci spiega perché un altro muscolo è diventato contratto e crea un problema. Okay? Perché il click dell'anca davanti è un problema dello psoas, però lo psoas è diventato problematico perché il suo antagonista ha smesso di lavorare, quindi non gli dà la giusta resistenza. Ora io ho riattivato l'antagonista e dovrebbe allentare un po' lo psoas. Può non essere immediato, ci può volere qualche seduta, però tendenzialmente la strada è questa. Rilassata. Faccio ogni tanto qualche piccola chicca accademica. Lascia. Prova a alzare la gamba e abbassarla.
Scrocchia.
Scrocchi ancora. Se io ti tengo lo psoas, vai.
Sì.
Devo trovare il punto giusto. Vai.
Vado. Sì.
Però senti che mi scrocchio sotto la mano?
Sì.
Il tendine.
Fa male.
Ti chiedo scusa, vai. Meno, è
Sì.
giusto. Perdonami, vai.
Meno?
Benissimo,
Pochissimo.
ancora. Perdonami,
Nulla.
vai. Adesso quasi niente. Vai. Quasi niente, un altro così. Ancora. Ok. Perfetto. D'accordo. Adesso noi abbiamo visto ci sono alcuni punti sul corpo che ti danno fastidio,
Sì.
giusto? Mani qua su da me. Qui è piuttosto evidente, forse lo sentirai anche tu, che l'indice sinistro è più corto del destro di circa una falange, no?
Sì.
Girami la testa a destra. Così pareggia. Lo senti?
Sì.
Ora giù. Tieni la testa a destra. Hai ancora fastidio qua?
No.
Testa su, testa dritta.
Ora sì.
Ora sì. Vediamo anche se... Sì?
Non tanto.
Gira la testa di qua. Cambia?
Per niente.
Per niente, ok. Quindi un minimo c'era.
Sì.
E poi dovresti avere qua.
Un minimo?
Gira di qua.
Per niente.
Ok. Quindi la rotazione destra del capo ci aiuta a eliminare le tensioni dal corpo. Ok. Adesso vediamo il ginocchio. Cominciamo così. Punta al tallone. Adesso ti faccio spingere il piede internamente così, contro la mia mano, senza fare questo.
Ok.
Vai. Vai. Non è tanto buono, eh. Facciamo l'altro. Vai. Senti che questo è più forte.
Sì.
No. Questa volta il piede è aderente al lettino, lo giriamo in dentro.
Ok.
Senza staccare il piede dal lettino, tira il piede su verso il sedere, vai. Ok.
Vado?
Ok. Tieni dritta. Spingi su. No, scusami, la gamba. Vai. Qui non riesci tanto ad attivare. Facciamo così. Applico uno stimolo di vibrazione. Piega. Spingi in dentro. Come
Meglio.
vero? È abbastanza evidente, no?
Sì.
Poi quando lo senti è un'altra cosa. Vederlo magari in video puoi non crederci, ma quando lo senti è inobiettabile. Piega. Rilassata. Lascia. Mano qua. Rilassa. Lascia. Lascia morbida qua la spalla. Ecco fatto. Mi dici, aspetta, se ti fa male quando ti piego il ginocchio.
No.
Ok, non è libero. Rilassa. Tieniti con le mani qua. Io ti tiro, Ok. Rilassa. Ok, questo è andato bene. Perfetto. Io ti tiro. Ok, no, qui va bene. Te scrocchi da sole le dita. vede subito. Morbida. Ok, mano qua. Appoggiati sulla mia mano. Ok. Ok, perfetto. Ora, ti ricordi quando giravi la testa di qua?
Sì?
Ritrovavi, cioè toglievamo la tensione dal corpo, no? Vuol dire che l'emisfero sinistro del tuo cervello sta lavorando meno del destro. Ora lo stimola a riequilibrarsi.
Ok.
Lascia, lascia. Ok. Posso stimolare l'emisfero sinistro anche da destra, ma devo cambiare vettore. Non posso far così perché altrimenti starei stimolando il destro.
Ok.
Quindi sto dritto e inclino sulla testa così. Lascia. Ecco fatto. Fatto male?
No,
Dimmi ora. Fastidio?
no. No?
Rimane solo questo.
Sì.
Sdraiata di fianco verso di me. Rilassata. È andato. Meglio, no?
Sì.
Altro lato. Più avanti col sedere. Col sedere, non col... ecco fatto. Le spalle stanno qua. Altrimenti avrai la sensazione di cadere, così invece non ce l'hai.
Ce l'ho.
È perché ti opponi. Se io ti tengo
ok.
qua non ce l'hai. Se tu invece vuoi venire qua ce l'hai, capito?
Ok.
Se ti tengo qua no. Rilassata. Lascia. Ecco fatto. Piano piano, pancia sotto. Questo è il ginocchio operato. Si vede anche che è un po' più gonfio dell'altro. Ti farà probabilmente male qui. Perché questo muscolo dopo l'intervento di solito ha bisogno di una riassestata. So che l'intervento è stato fatto 12 anni fa, ma te l'ha mai fatto nessuno qua dietro qua?
No.
Questo? Vedi.
Infatti fa male.
Lo so, fa male perché il muscolo non lavora bene. È sopportabile?
No,
Lo so che stai soffrendo, ti chiedo scusa perché
nulla.
questo l'hanno fatto anche a me e so benissimo che qui, ecco, qui potresti avere anche fastidio, vero? Perché questo è il muscolo che quando ti ho testato a pancia in aria era debole, il piriforme, quindi lo stimolo a riattivarsi. Rilassata, faccio tutto io, sentirai solo il rumore del lettino ma nessun dolore, ok? Qua. Puoi raccontarci qual è il motivo della visita?
E soffro di cervicale
Da quanto?
da circa 4 anni.
Ok, ma questi fastidi che tu hai sulla cervicale rimangono circoscritti o si irradiano sulle braccia e sulle spalle?
No, rimangono in questa zona qua.
Sul trapezio arrivano. Ok, perfetto. E di notte in che posizione dormi?
Su un fianco con 2 cuscini.
Sempre lo stesso?
No,
Però 2 cuscini.
sì, non...
Ok. E da 4-5 anni fai sport?
no. Da quando ho iniziato a lavorare che insomma sto sempre seduta tante
ok.
ore, quindi con la postura evidentemente.
Computer, telefono?
Mhm.
Ok, perfetto. Adesso sappiamo molto probabilmente perché hai dolore al collo. Va bene, interventi chirurgici?
No,
Infortuni, traumi, incidenti? Niente di tutto ciò, perfetto. Cadute sul sedere, traumi al volto? Niente di...
no, nulla.
Lavori con i denti?
No,
Ok, perfetto. Allora direi possiamo iniziare. Non ti ho chiesto, ecco questo è importante, se hai problemi a livello circolatorio, pressione, colesterolo,
no, nessun problema.
se hai tendenza a fare coaguli, cose così, no. Perfetto.
No.
Allora facciamo così, accomodati seduta. Ora, questo solitamente è un piccolo protocollo che io faccio sulle ernie cervicali, però su di te, che mi auguro tu non abbia ernie, hai mai fatto raggi, risonanze?
No, non lo so, perché non l'ho mai fatto.
Allora vedo un po' di cose prima. Fastidio qui?
Sì,
Di qua?
no.
Se vengo su, fastidio qui?
Di più rispetto a destra.
Quindi sinistra-sinistra.
Mm-mm.
In mezzo sarà più doloroso a destra. Sinistra meno.
Sì,
Girami per favore, anzi la giro io, morbida. Ok. Adesso io ti tengo, girami tutta la testa a destra. Ok, considera il naso punta qua, dovrebbe essere sopra la spalla. Andiamo dall'altro lato. Un po' meglio, però anche qui non è completo. Adesso, tieni qua. C'è un lato che ti fa più male dell'altro?
No.
Ok. Allora, testiamo un po' di muscoli. Spingi il braccio così, vai. Capo corto del bicipite va bene. Spingi su così, senza distendere il braccio, devi spingere. Vai. Capo lungo anche. Tieni qua. Spingi su, senza piegare. Spingi su. Fai un po' di fatica qua.
Sì.
Vediamo il gemello. Guarda dritta. Senza fare così, così, così.
Ok.
Dritta proprio. Spingi su. No, già sei così. Vai. Ok, no, qui va bene. Spingi in giù così, vai. No. Esatto, vai. Qui va bene. Vai. Qui va bene. Vieni in piedi. Allora, tu mi hai detto che il dolore si irradia un po' qua.
Sì.
Questa distribuzione di pelle viene innervata da C4, quarto nervo cervicale. Quindi per testarlo userò il tuo gran dorsale. Ti faccio girare così, gomito esteso, punta il pollice in dentro, così. Adesso io ti chiederò di spingere indietro e verso il centro mantenendo il gomito dritto e io tiro in fuori, ok?
Ok.
Vai. Vai. Non va tanto bene. Gira la testa di là. Dritta. Vai. Vai. Meglio. Gira verso di me. Vai. Vai. Fatica, eh?
Sì.
Ok, perfetto. Vediamo anche questo per essere scrupolosi. Testa dritta, spingi in dentro, vai. Non solo in dentro così, ma anche indietro. Vai. No, questo va bene.
Questo sì.
Ok. Allora, vieni seduta. Ora voglio vedere se questo ha un riscontro anche a livello cutaneo. Quindi ti faccio stringere pollice e mignolo insieme. Stringi. Ok. C4, stimolo. Stringi. Stringi. Si apre. C5. Stringi. Si apre. C6. Stringi. C6 vedi resta chiuso. Apri. C7. Stringi. Anche C7 resta chiuso. C8. Stringi. C8 resta chiuso. D1. Stringi. Ok. Solo C4 e C5. Adesso gira la testa di là. Stimo nuovamente C4. Stringi. Adesso lo tieni chiuso. Devo spingere talmente forte che mi scrocchiano le dita addirittura. Tieni sempre la testa di là. Vediamo se questa è la stessa direzione che corregge C5. Stringi. Sì. Testa dritta. Adesso ristimolo. Stringi. E apro. Stringi. E apro. Con la testa dritta. Ci fai caso, no?
Sì.
Interessante, non trovi?
Molto.
Col sedere sul bordo, per favore. E ti faccio poggiare la schiena contro la sedia. Vai, così non si incastrano i capelli.
Ok.
Perfetto. Adesso, questo è C2, C3, peggio C4
Ah, io sì.
o C5?
C4.
C4, eccolo qui, colpito affondato. Quindi abbiamo visto che la direzione che migliorava tutto era questa. E da qua, lascia morbida, rilassata. Eccolo, si è sentito.
Sì.
Gira, spingi in dentro, vai. Vedi che adesso lo tieni?
Sì.
Prima lo tiravo via, invece adesso lo tieni. Vieni seduta. Vediamo anche se fai difficoltà col deltoide come prima oppure no.
Ok.
Spingi su. Meglio, però. Esatto.
Ah, devo.
Esatto. No, non devi spingere perché sennò è. Spingi? No, comunque va bene. Perfetto. C4 con la testa dritta, stringi. Non si apre più. C5, stringi. Meglio. Benissimo. Tu non hai altri problemi a parte la cervicale, vero?
No.
Ok, allora sdraiata a pancia in aria. Cioè altri, diciamo, dolori. Perché io, infatti.
Altri dolori ho la luce valgo. quindi ogni tanto mi fanno male, quando indosso scarpe con il tacco mi fanno male le ginocchia.
Ok,
Non
tutte e
so se
due?
possa essere...
Questa è un po' più corta di questa. Rilassata, morbida? Sì. Hai fastidio qua?
Un po' sì.
Rispetto a questo?
Sì, di più a destra.
Ok. Tieni la testa così. Ora?
No,
Testa dritta? Fastidio?
sì,
Rimetti la testa come prima?
no,
Ok. Testa dritta?
sì,
Testa come prima?
meno.
Meno, ok, però c'è ancora un
Un
pochino.
pochino sì.
Testa al centro. Questa mano qui. Un po' più dentro se riesci, perfetto. Rilassata, rilassata. Lascia morbida, morbida. Ecco fatto. Poi. Qua un po' di fastidio forse.
Mhm.
C5. Lascia, appoggia la testa sul lettino. Perfetto. Ok, adesso con la testa al centro. Fastidio?
No, no, no,
Ok, buono.
benissimo.
Morbida? No, qui va bene. Sì, generalmente, cioè, a livello complessivo stai bene, non hai problemi. Morbida? Lascia. Il ginocchio infatti. Vediamo se anche di qua. No, questo sta meglio. Mano qua. Giù, giù, giù. Eccolo. Ok, perfetto. A questo punto, pancia sotto per favore. Finalmente un caso semplice. Ok.
Le braccia...
Hai braccia, bravissima lì. Ok, vado a lavorare un pochino sulle ginocchia, ok? Ti avverto, questo è un po' fastidioso. No, Francesca è brava, non si lamenta. Perché so bene che questo è fastidioso. I tacchi, i tacchi.
Ah, per questo?
Sì.
Ah, qua di più.
A destra hai l'alluce valgo un po' più accentuato, non
Sì.
so se hai notato. Quindi il piede, quando porti i tacchi, specialmente alti a spillo, assume una posizione ancora più scomoda.
Qua fa malissimo.
Ti chiedo scusa, non è mia intenzione farti male, però è mia intenzione aiutarti. Facci vedere in camera qual è l'espressione del dolore?
Un sorriso.
Un sorriso. E ho visto la mia fine sul tuo viso. Come per citare Battisti. Morbida? Ok, oggi è la giornata delle citazioni. Prima Verdone, oggi Battisti. Quando tocco hai più fastidio? Qua o qua?
Mi sembra uguale.
Ok, allora andiamo su altri 2 punti. Qua o qua?
E destra.
Ok, se la gamba destra si è corta, diventa pari, perfetto. Allora ti faccio accomodare sdraiata sul fianco sinistro. Piega. Ok. Ti metto bene in posizione. Tu di cosa ti occupi, Francesca?
Sto facendo un dottorato.
Ah. In cosa?
In economia aziendale.
Complimenti. Questo era il punto che toccavo e ti dava fastidio. Non inarcare la schiena. Bravissima, tienila così. Con la testa guarda il soffitto. Perfetto. Dolore?
No, no, no.
Ah, ok. Pancia sotto. Quando tocco ora?
No, non mi fa male.
Ok. Qui?
No,
Qui?
no,
Qui?
no,
Qui?
no.
Ok. Cammina un po' per favore, mi dici come ti senti? Se mi devi dire qualcosa.
Benissimo.
Collo?
Sì, è più leggero.
Meglio, eh?
Sì,
Ottimo.
molto più leggero.
Guarda, anche qui io non andrei a sconvolgere un equilibrio, diciamo, di sottofondo che tu hai, ok? Perché tu tendenzialmente stai bene, però per lavoro,
Sì, esatto.
e questo ti condanna la cervicale di giorno, di notte 2 cuscini e quindi
Lo so.
hai bisogno del chiropratico, va bene? No, però adesso scherzi a parte, c'erano sicuramente un po' di cose da mettere a punto, le abbiamo messe a punto. Una cosa in più la vorrei fare, questo me lo prendo io, vieni seduta. Questa mano qua su, alza il gomito più in alto che riesci. Ok, questa si muove, vediamo questa. Non c'è male, vieni in piedi, mani sui fianchi così, spingi piano piano il tuo gomito indietro contro il mio e tira un colpo secco, più veloce, però piano piano, non forte ma veloce e non tutto insieme. Ascolta quello che ti dico. Piano, ora veloce. Guarda. Ah, ho scocchiato la mia. Vai. Ok, dammi l'altra. Vai. Eccola, questa è andata. Ok, torna seduta. Questa la facciamo in un altro modo. Questa mano qua dietro. Rilassata, fammi muovere bene il braccio, fammi muovere, fammi muovere. Lascia, lascia. Eccola là. Ok, ci siamo direi. Come ti senti? Mi hai già detto bene?
Bene,
Quindi
molto leggero.
mi raccomando, quando lavori, computer, cellulare, cose così, cerca di non arrivare così, ma aiuta molto a appoggiarsi al sedile della poltrona. Ok?
Devo farci caso.
Esatto. E se riusciamo passiamo anziché 2 cuscini a un cuscino la notte. Va bene?
Ci provo.
Ti faccio preparare.
Grazie.
È stato un piacere.
At her x-ray and we did a full examination on her, and one of the things we noticed was a little bit of a trouble spot, some degeneration in the lower part of her neck. Did anything happen 10 years ago?
I was in a lot of sports.
And she had a little bit of restriction in her shoulder, which I think is a contributing factor. Like what sports?
I was a power lifter. I was
Okay.
a cheerleader.
Mhm.
Anything extreme.
That's another tight spot too, huh?
That's like the big one, like that here.
Uh-huh.
I don't have to tell you, obviously you just found that.
What sort of activities do you notice get affected?
Sometimes I know a little bit of weakness if I look up or just really lifting up the left shoulder, which is huge in what I do as a ballroom dancer.
Sure.
At this point, I basically try to avoid anything overusing the left shoulder. By overcompensating using other muscles or other sides of my body, sometimes the pain will switch. So at this point, I would just like to kind of get to the root of it and figure out
Sure.
what I can do.
What have you tried so far?
I've tried stretching, strengthening my back muscles, meditation, breath therapy. I've tried another chiropractor.
What was that process like for you?
And maybe there's a little bit of fear factor in that, but
Do you have a fear factor right now?
a little bit.
Okay.
Now I do the waltz. I chose a much more relaxed way of life.
So your hip flexors are a little bit weak on the one side, and the nerve that controls that comes out right here.
Okay.
All right. So what I'm gonna do is manipulate it. Give me your arm. You okay?
Yeah.
Good. Lay on your back.
Shag hurts so good.
There you go.
Thanks, Dr. Hoare.
Anytime. So what we're gonna do is I'm gonna do the examination on you, figure out what's going on with your neck and your shoulders, and then we'll do the chiropractic treatment first. Yeah. Okay. So I'm gonna adjust that segment right here.
Okay.
All right. And you're a little nervous, right?
I'm nervous, yeah, because it's just tight in general.
Your hair's a little caught up.
Here, there you go.
That's good. Fine. Right there. Can you feel what I'm talking about?
Yes.
That little. Okay. Well. Good.
Oh, that was easier than I thought.
And look how much better it moves.
Yeah.
That's good.
That was a lot easier than I thought. This side I'm a little more nervous. But
Yeah. All right. Drop. Good.
that was better than I thought too.
Yeah. Oh, that went nice and smoothly. Do a little traction here. I'm gonna tilt your head over here. I'm gonna push your head here and push your shoulder there, kind of away from each other.
Okay.
So don't let me do that, okay?
Okay.
Ready, go. Here and here, same deal. Ready, go. And that's stronger, isn't it?
Yes.
So we're gonna adjust a little bit lower on your neck, right over there. And we're not expecting the big pops and cracks like we just got.
Okay.
Because we already adjusted. Good. All right. Hold it right there. I'm going to push here and here. Don't let me. Ready? Go. I'll do some muscle tests. Make a fist. Pushing down. Don't let me go. The muscle they just tested weak is called the coracobrachialis, and it attaches right here at the AC joint. So we'll go in right here and give a look. Make a fist. Pushing down. Don't let me go. So that nerve is the C8T1 nerve that we were testing. So I'm going to adjust this area right here. Good. I'm going to stick my thumb right in your armpit, wrap my hand around your shoulder blade.
There we go.
Okay.
Okay, just let me.
Right there's good. Put your left hand on your ear. Good. And good. And I'm going to thrust down there like that, okay?
Okay.
Deep breath. Breathe on it. Good.
Oh, that was great. What was that? What do you? That was great. Okay.
Hold on here. We'll do the muscle test. I'm going to pull out.
It's
Don't
very
let me.
strong. Okay.
Ready? Go.
Okay.
What I'm going to do is an adjustment where your sternum and your ribs meet each other. Okay, so I'm going to go
Okay.
right in here, and we'll do an adjustment. And frankly, this one doesn't feel great. Okay. Good. Hold it right there.
Okay.
Pushing out there. Don't let me go. Chin all the way to your chest. Bring your head up like that. That's good. Okay. That was fun, huh?
That was a word for it.
All right, so you see, what I'm doing is I'm doing muscle tests, and that tells me what areas need attention, right?
Okay.
And I am kind of testing the muscle, but I'm caring more importantly about what
Okay.
controls the muscle. And that tells me neurologically, as a chiropractor, what I need to start dealing with. Because we're taking all these imbalances of yours, right? We're looking to reduce them as much as possible, aka get you back to normal. And then we're going to do the progressive rehabilitation, where we create better posture, better movement for you.
Okay. Awesome.
Make sense?
Yeah.
We'll do the lower part of your neck right there. Good. One you liked on the other side.
This one's my favorite.
Deep breath. Breathe on
Okay, just not anymore, actually.
it. Yeah. All right. A little bit different spot here. So that was painful, huh?
A little bit. Not. I wouldn't say pain.
Breathe out. Okay. Good. Hold it right there. Pushing that way. Don't let me go. Good. Pushing that way.
Oh, like this. Okay.
Pushing that way. Don't let me.
Okay. Good thing I wear stretchy pants.
Yes. Good thing. Okay, good. That opened it up real nice. So that was just a hip socket mobilization. We'll do the same thing over here, because you said this one you could feel some discomfort, right?
Yeah. My husband has a problem with this. I should bring him in here.
Well, most people's hips aren't moving very well. Ooh, yeah, this one's a lot tighter though.
Yeah.
On the other side, isn't it? Okay. Wow. Not bad,
Much
huh?
better. Yes.
All right, good. Pushing down and out. Don't let me. Go.
Okay.
Towards me, that's perfect. Scooch it just a little bit. Good. Good. Lay on your back.
See my face.
Pushing down and in. Don't let me. Ready? Go. Yes. And let it go, breathe. Good. Okay, lay on your back. We'll do a quick, your right ankle is a little bit stiff. You know that?
Sometimes, I mean, it's not something that like actively bothers me, but.
Okay. I'm gonna give it a quick little yank here.
Oh.
Good.
Okay, that's a first for me, I think.
Okay. Actually, I want to check something though. So you're not. See, like I don't feel a lot of tension or stiffness, a little band in there, but
Sometimes, like, I don't know now, I do feel a lot better than when I walked in here.
just kind of pop out. So we're gonna make sure it's not. One more here. Good, yeah. Amanda, what was that like?
It was great. I was a little bit nervous in the beginning, and then after we went through some of the adjustments.
He didn't even tell me he had 15 before he threw a 20 or 25 on me.
That's correct.
I mean, I felt immediately better after each different thing that you did, and exercises that we did afterwards, I feel like that would really help me. Never had anybody show me that way. It was effective, but it was simple, so I thought it was going to be a little bit more complex.
Well, we're not very complex around here. I'm gonna put my fist between your knees.
Okay.
Try to break my fist. Good. Keep.
Okay.
That's one of the cool things about the system we use for the treatment is instant feedback on did this work or not. Pressing reset buttons throughout your body. And then through the progressive rehabilitation, you're actually learning how to change how you move so that you're not 10 years from now still saying, oh, I've had this neck shoulder thing for about 20 years.
Right.
You know. So if you no longer had to deal with this neck and shoulder thing, what would that look like in your life?
It really kind of gave me a dull, chronic frustration. So I think it would just give me a little bit of levity to my life, probably. We all try to be professional, and I try to give everything that I can. I don't know if they know that there's a brighter version. I'm really looking forward to seeing these exercises that I won't have such a discomfort after the movement lesson.
Sure.
So, and I definitely think, you know, knowing going into that, feeling more confident, and just getting strength in the shoulder, I definitely think that I'll feel better about it. If I feel better about it, they're going to appreciate.
You have really good range of motion. You do not have the stability and strength that you probably did have in the past.
Right.
And that's the sort of thing we can address. We can stabilize your shoulder so that maybe it's not perfect, but we restore confidence, comfort, strength, stability to the area. Good. Lunge on one side and then lunge on the other side. Perfect. Good. Okay. Feel how your neck is moving and feel for any restriction in there, and that'll kind of tell me what we need to do. You got a little bit of restriction right there. Could you feel what I'm talking about?
A little bit.
A little bit? All right. So I'm going to go right over here. And that spot right there, it's a little bit restricted. So I want to get some motion in there, okay?
Okay.
You ready?
Mm-hmm.
You sure? All right. Drop right there.
Oh.
Good. You all right?
Yes.
All right, good. We'll go on the other side. Okay. Good. All right, and you got a little bit over here on the other side as well. So let that go. Very good. All right, you okay?
Yes.
You seeing straight and everything?
Yeah.
All right, not too bad, right? All right, good. So the neck part's over, so the scary part's over for you. For me? Good. Deep breath. Breathe out. You all right? Breathe out. You feeling okay?
Yes.
You're not hurting?
No.
All right, good. All right, I'm going to do some muscle tests of your lower body here. I'm going to push down like that. Don't let me do that. Ready? Go. All right, okay. Breathe out. Good. Okay, let's have you go face down now. You doing okay?
Yes.
You're moving slow. All right, I'm gonna do this muscle test again. Pushing right here, don't let me. Go. Hold it right there. I'm gonna push your leg down into the table. Don't let me do that. Go. Awesome. Other side. Up here. Pushing down, don't let me. Very good. Okay, let's on the right side. I'm going to adjust your L2 segment to see if we can't get that a little bit better. Okay. Good. You having a good time here? All right, breathe out. Do that again. Breathe out.
Oh.
Good. All right. Lay on your back. Breathe.
Oh.
Good. Lay on your back. You all right?
Yeah.
That one hurt a little bit, huh? I'm going to grab your hip flexors like this. When I say so, start in position.
Okay.
All right, so I'm going to grab your psoas muscle right here. And now straighten your top leg and bring it back towards me. Good. And again. And there's plenty of tension in there, isn't there? Okay. Again. And again, now we're going with the iliacus muscle. Just as painful?
A little more.
And again. So it's a little tender, huh? Okay. Good. Just one more here. Good. Okay. And now I'll do some stuff on my own. Now we're on the TFL, tensor fascia lata, which is another hip flexor muscle, which she'll tell you, plenty tight, isn't it? When we have certain areas of our body that don't have the stability and control that they need, it really overtaxes the muscles in the area. So the muscles start becoming tight, stiff, tender, that sort of thing, because the actual core stability of the joint in there is inadequate. Good? Now I'll grab the back of your hip. When I say so, I want you to lock out your leg, kick forward and towards the floor as far as you can. So I'm grabbing the piriformis muscle, some of the external rotators, our glutes, and again, we've got some tension, especially right in the posterior capsule of her hip, and that's what is making her feel a little tender at the moment. Again. Good. All right. Kick forward all the way. Hold it right there. Good. A little tight, isn't it?
Oh, so my Achilles are just like really bad right now.
I was going to say,
It's been really terrible.
Okay.
Both of them.
Well, I'm glad that that came up.
I forgot.
So that we can address that. All right, I'm going to do some muscle tests. Bring your foot up and out. Hold it right there. I'm going to push from this direction. Don't let me. Good. Now I want you to point your toe and go out. Good. I'm going to push from right here. Don't let me. That's great. Now point and in. Hold it right there. I'm going to push from over here. Don't let me. Good. And up and in. Hold it from there. Pushing from right here. Don't let me. Some segments here. Oh, can you hold on to the table? Make sure you don't slide. Good.
Oh.
Yeah. Getting some noise out of those, huh? Okay. Up and in. Hold it right there. I'm pushing from over here. Don't let me. Great. Point. Okay. Table. Hold on to it. Good. Okay. Point and in. Pushing from here. Don't let me. Seems to me like the left one is a little bit tighter. Is that what you're noticing? Or are they both?
Honestly, I haven't been paying much attention. But right now it feels like, come down more?
Yeah.
Right now it feels like the left one, yeah.
Yeah. Go get her face. Face or something. Tight, huh? So I'm feeling for the tension not only in the Achilles, but also in some of the deeper muscles. The flexor digitorum, the flexor hallucis longus are both muscles that are deep to the plantar fascia and the calf, but they're an important part of the tension in the Achilles. So we're looking at a lot of stuff here. Good. Okay, so that's the treatment today. So we did the chiropractic first, then we did the progressive rehabilitation. First thing I want to ask is, Nina, how are you feeling?
Much better.
Okay. Are you feeling anything different in your hips?
A little looser.
A little looser? Okay. Good. And what did you think of the exercises we gave you afterwards?
I think the adjustments definitely help. I think it's nice to have somebody who knows what's going on tell me like what is appropriate to do and what's not appropriate to do, like as I'm healing.
Mm-hmm.
Because I was pretty much scared to do anything
Sure.
at all. So you telling me like this is okay, this is not okay. I don't know, just really helped me get back in the gym, which was
good.
What I needed.
So now you're back in the gym, right? And are you limited? Like, what exercises are you avoiding or not doing, or are you doing everything? How is it in the gym right now?
So now I'm doing everything.
So we're back to doing squats. We're back to doing lunges. We're back to getting those gains back that you were losing, and you're not feeling restricted or limited while you're CrossFitting.
And I had to stop for about a month and a half. Must have done a movement and strained it slightly, but thought it was nothing, and then kept going and going and just doing everything as usual, weights, practice, conditioning, and then it just...
In the last 2 years, as it's kind of gone up and down, what have you tried to have it get better?
I've tried rehab to strengthen. I've tried stretching a little bit more, because I'm very inflexible. It's very frustrating because whenever I start to feel it a little bit, I don't want to push myself because I'm worried that it'll get to that point again. So even when I feel something slight, it frustrates me, and I'm scared to keep practicing or keep training.
Well, we're going to make sure we do a full physical exam and get a medical history on you and make sure whatever we decide to do is appropriate and will help your hip going forward, okay?
Thank you.
Well, this should be a great experience for you, and hopefully you get to learn a lot while we're helping you out. So let's get to it. Okay, so we did an examination and reviewed medical history for Alexandra. So we're going to jump in here to the treatment part, and we're going to see what we can do to help out with her hips. And as chiropractors, we always want to start at the spine and then work our way towards the extremity. So I'll start right here with the neck, and I'm just going to feel for your motion. Now, we did notice, Alexandra, a little bit of limitation and discomfort during the exam. Is that correct?
Yeah.
All right. And you've noticed lately increasing stiffness in the neck, huh?
Mm-hmm.
Okay. So what I'm going to do is just palpate some of the muscles in the area, and I'm looking for specific spots. I'm going to pull your hair here a little bit, where we can hopefully help and reduce some of the muscular strain in your neck. A little bit of tension in there, right?
Mm-hmm. I can feel it.
Yeah. That was my elbow. So that segment right there is a little bit limited. Can you feel that it's limited or stiff in that area? It hurt?
Yeah, when you press on it.
So it was my fingers pressing that hurt, or was it the movement itself?
Your finger pressing on it.
Got it, okay. A little bit of a release there. All right, so you certainly have a little bit of muscular tension in your neck. What I'm going to look at right now is the restriction. So we go right over here. You feel the difference?
Mm-hmm.
It's not as good, right?
No.
So let's address that. So I would like to do a neck adjustment on your neck. All right? I know you're uneasy about that. Are you okay with me adjusting you?
Yeah.
Okay. Now what we do with an adjustment is it's just like cracking your knuckles. I'm going to bring you to the end range here, and then I will do a little thrust, okay? You seem very uncomfortable.
I'll be okay.
It'll be fine, okay? So, right there.
Hi.
Good. How you doing?
Oof.
Are you okay?
Yeah.
So we'll go right back over here to just feel. Does that feel different to you?
Yeah, it feels less stiff.
Good. There is a little bit over here as well. Are you comfortable with me going on this side?
Yeah.
Okay. Okay, you ready?
Mhm.
Good. Okay. And the scary neck part is over. Good. So now I'm just going to go back to a little bit of muscle motion. There's not going to be any sudden thrusts or anything like that, okay? Still a little bit of tension, actually. Right over there. You feel that?
Yeah.
I'm going to do a couple of muscle tests here to see what's going on down there so we can see how we can improve it, okay?
Mhm.
So make a fist. I'm going to do a muscle test where I push down into the table. Don't let me do that. Ready? Go. Good. No problem. Your thumb and your pinky. I'm going to pull them apart. Don't let me. Ready? Go. It's just a little bit weak. Okay. Relax. All right. I know I told you I wouldn't do any neck adjustments, that we're all done, but I think I lied, okay?
Okay.
I would like to adjust down here. Now down here is your C7, T1, okay? And these nerves right here are part of what controls that weak muscle test that we just did. Okay, so I'd like to adjust down here, all right? Let it drop. Good. And now we'll check back over here, thumb and pinky, pulling them apart. Don't let me. Ready? Go. That's where I'm going to pull your elbow in this fashion. Don't let me, okay? Ready? Go. That's pretty good. All right, I like that. Your head, we'll put it over here. I'm going to push your head and your shoulder away from each other. Don't let me do that. Ready? Go. Good. And I'm going to do the same thing on the other side. Ready? Go. Great. No problems. Breathe out. Good. There we go. You okay? You sure? Yeah. You don't look like you're having a blast so far. Any irritation there?
No.
Now, where are you feeling the pain when you feel it?
It starts here and it goes all the way down.
It shoots, does it go all the way to the knee?
No, like it normally stops around there.
Comfort when you did that. Push in there, don't let me. Ready, go. A lot stronger on this side.
Yeah.
So that's one of these imbalances that we're looking to correct. Okay, so turn on your side, face this direction. All right, so what I'm going to do now, the muscle that just tested weak was your rectus femoris, which is one of your hip flexor muscles. Now, that muscle, the nerve that supplies it, comes mainly out of right here. So we're going to do an adjustment to that segment right there. Good. All right, lay on your back. I'll do a muscle test of that same area. Straighten that guy. I'm going to push down. Don't let me. Ready? Go. We'll do some other muscle tests. I'm going to push down and out like that. Don't let me. With this other hand, I'll just be stabilizing your leg. Ready? Go. And that was pretty weak, and then you had a nice pop. Does it pop like that a lot, or no?
Sometimes.
Okay.
Yeah.
Okay. Pushing down and out. Don't let me. Ready? Go. Good. Let me see your arms. All right. Face towards me. And that adductor muscle that just tested weak mainly comes out of L3. Yep. Good. Lay on your back. I'm going to push down and out. Don't let me do that. Ready? Go. Good. So both are firing nicely, even though that caused some irritation to have that little pop right there. So that's good news. We're going to push down and in. Don't let me do that.
Oh, sorry.
So resist right there. Ready? Go. Great. Down and out. Down and in. Don't let me. Ready? Go. Very good. Toes up. I'm going to pull down like that. Don't let me. Again. Okay. Down. Don't let me. All right, good. Can you flip around on your belly?
That's stiff.
Yeah.
Both sides. This one less than the other.
Yeah. Agreed. Okay, so I'm going to do a little manipulation into external rotation here, okay? One more here. Good. And that hurt. It was pretty uncomfortable, yeah?
Yeah.
Okay. A little bit easier now, though, with that motion, so that's good. A couple more muscle tests. Going to push down. Don't let me. Ready? Go. Again. Good. I'm going to do a little bit there. Good. Go face down. And raise your knee up. I'm going to push down into the table. Don't let me. Go. Good. This guy, bend here, raise up. Pushing down into the table. Don't let me. Lovely. Flip around on your back. You got some flat feet, huh?
Yeah.
How'd you get this?
I walked into something. You know those, like, when you park your car, they're right in front of the car?
Uh-huh.
Yeah, I walked into one of those.
Okay. So you've got flat feet. They're also kind of stiff. I'm going to do some muscle tests with the feet too, okay? So this foot is up and in. Hold it like that. What I'm going to do is push from this direction. Don't let me. Go. That's great. Point and in. Good. I'm going to push from this direction. Don't let me. Go. Great. Point and out. I'm going to push from this direction. Don't let me. Go. Good. Up and out. Hold it right there. Push from right here. Don't let me. Good. Nice and strong. That's great. Up and out. I'm going to push from right here. Don't let me. Good. Point and out. Push from right there. Don't let me. Good. Point and in. Push from right here. Don't let me. Great. Up and in. And push from right there. Don't let me. Very good. Okay, so all your muscles are firing pretty nicely. Now we just want to see if we can loosen up your foot a little bit to provide a little bit more shock absorption when you walk. Man, that is stiff right there. Right in the middle of your, yeah, right in the middle of your arch. And it hurts?
Yeah.
All right, so I'm going to do an adjustment where I kind of yank on your foot. Could you hold on to the table so your body doesn't slide? Good. Now we'll go back over to the arch. A little bit better motion there. One more yank over here. That's good. See, this arch moves just a little bit easier, doesn't it?
I still feel it though.
Yeah. All right, I'm going to do a yank from over here. Good. So with this left foot, your heel likes to invert fine. Eversion, do you feel how much it just doesn't like that?
Yeah.
And on this side, it inverts great. But there's some nice give to your eversion. So I want to improve that over here. Because any restrictions or fixation in the joints of your foot can lead to compensation in other areas. Okay. So what I'm going to do is this is going to look a lot scarier than it's going to feel. All right. I'm going to evert your ankle and then I'm going to do that. One more here. All right. And now there's a little bit of motion. It's not wonderful, but it's better. Good, and we got one more here. Hold on. Great. I was doing myofascial releases on your hips, both to your hip flexors in the front and then some of your glutes and external rotators in the back. What did that feel like for you?
That was painful because I felt like every point that you were pressing was tender when I was making the movements.
Yeah, we got some serious tension, huh? So this is a myofascial release, so anywhere where over time the muscles have too much stress and too much tension, that alters how you move and control your hips and pelvis. So by releasing them, it will help to normalize the forces on your hip, but that doesn't mean it feels good to get that done. No. Last one. Good. Down towards the floor more. Yeah. Good. Come on back. And I'm feeling like the tension is down there. So that's what I want to release. What's under my hands right now are the tissues I'm actually putting attention on them, which helps to release them. So keep going, keep going, keep going. This is called hip flexion, this motion. Keep going. And obviously it's not great, right? It feels painful and stiff. So during the progressive rehabilitation, we're going to give you some exercises to start retraining this. Alexandra, what was that like?
It was different.
You look like you hated it.
No, I didn't hate it. I didn't love it.
What were your not favorite parts?
The neck.
The neck adjustment, right at
the
the
neck.
beginning.
Yeah.
That's not an uncommon experience. There's plenty of people that love that stuff. There's plenty of people that hate that stuff. And then there's plenty of people that are uninterested in actually getting this kind of care because of the fear and concern about those adjustments. How do you feel right now as a result of the treatment?
I feel very relaxed, especially more in this area. So I think that I had a lot of strain there that I didn't know I really had. That's been released now.
Yeah.
But no, overall I feel very relaxed.
All right. That was good though. It was good. Thank you.
No problem. Just relax on it. Just relax. Just relax. Let it drop. Let it drop. Wow.
He knows what he's doing.
So we're gonna adjust your shoulders now.
Okay.
Just relax on me. Just relax. How does that feel?
It's fine.
Just relax.
Ooh.
Man.
Smells so crazy. But good. It's working.
We're gonna do some grassing on your traps.
Oh my God, please.
You ever had this done before?
No, but I have very overactive traps.
Yes, they are very overactive. All right. I want you to try to depress this one for me. Just bring it down. There we go. So I got a little bit of CBD cream in your hair.
That's fine. That feels amazing.
Yeah?
Like, I need this daily.
But we here a lot of days.
There you go. It's because I do all these planks and stuff, you know?
Yeah. I've never done Pilates.
Really? You gotta come take my class.
I got you. You never done chiropractic? I never done Pilates. So
There you go. First time for everything.
That's
Let's
it.
get it.
All right, let's hit this other one. Yeah, you do. You do. All right. How does that feel?
Really great.
Yeah?
Amazing.
All right, good.
Wow.
I'm going to wipe you down.
Awesome. Thank you.
Just relax for me. Oh, I have this still. Good. Just relax. You got a lot of small tattoos.
I do.
You can't be from Miami.
I'm not. I'm from Philly.
Yeah.
No, stop. No way. That's my new best friend.
Chick-fil-A, Philly back there. Whatever. All right, let me have you. Let me have you lay on your stomach, face down. Slide down for me. All right, let your arms drop. So what I'm gonna do, I'm gonna have you this table move up and down. This is called flexion distraction. Okay.
Oh.
You okay?
Flexion distraction sounds crazy.
Slide down just a little bit more. There we go. A lot of things you hear in the chiropractic office sound crazy. Face up, face down.
Right, like context.
Yeah, it's like, oh my God. Just relax, just relax. Ooh. Ooh sounds crazy. Yeah, man. It's like, I think it's just the Pilates instructor from Philly. So. There we go. There we go. See? The list goes on and on. Just relax. Good. You're way higher on this side.
I know.
Like this round board. It's crazy. I'm gonna need to do a lot of work on you, but we got you. Slide down for me just a little bit. Now I want you to lift this leg up and keep it straight. Okay, all right, Pilates instructor. I want you to lift this leg up. There we go. See, if I was in your class, you would be on me. All right. Down, down. Switch. One more time. Lift this one up. And one more time, lift this one up. It's the bad side. Good. Uncross. Let's have you lift this up again. All right, good. Let me have you lay on your side, face me. Hug yourself. Bend this top leg, straighten the bottom. Good. Let me have you bring this hip forward from me. There we go. Just relax. Just relax.
Ooh. What the fuck?
The list goes on. Other side. How we doing?
We're good. Shit, it's working, so.
Good. Straight. Give me that. There we go. Bring this right here. Sit more. Good. Just relax.
Is my body okay?
You tell me.
Okay.
On your back?
Woo.
On your back. Other back. There you go. How we feeling?
Good. I don't know what's going on, but these cracks, I mean, they're giving something.
Slide down for me just a little bit. Hug yourself. All right. Just relax. Swing your feet around. Stand up. How you feel?
Amazing!
Test it out. Move around.
I feel like new person. No, really, like actually. Amazing.
I gotta do that in Pilates?
You gotta do a lot of crazier
can't.
things. You can't do that?
Uh-uh.
He's gonna come take my class. I'm gonna give it back to you. I got you.
That sounds crazy.
All those noises, we make the same noises in Pilates, okay?
I'm worse. I'm very like, my mobility is like on a scale from 1 to 10, it's a 4. Is this tight?
Yeah.
Okay. You exercise, Lou?
Yes.
Lou says she has a trainer.
Yes.
So Lou, I'm just gonna do something called grassing, okay? We're just gonna scrape right here. How does that feel?
Good.
That's good? Good. It's just our CBD cream. Right there? Lou, you ever been to a chiropractor?
No.
Why not?
I'm scared.
You scared?
I watched enough of your videos. I was like, okay, let me see what he looking like.
I get that all the time.
And not only that, I support Black-owned businesses, so.
I'm white.
Okay, Kodak.
My name made me smile when you see me. I'm white. Why are you shaking your head? Yeah.
That's not identified now?
I won't have to kick you out.
Right.
Yeah, those are the wrong numbers. This is a holy place.
Oh, yeah. Very, very
How we doing, Lou Kang?
good. I feel so good. Yeah.
Where you from, Lou Kang?
I'm from Miami.
You from Miami?
Yeah.
That's what I'm talking about. Finally, some Miami people. We be from all over the place saying I'm from Philly, and she like get excited because she from Philly.
That's
But
my
she's,
hometown.
that's what I'm saying, man. Born and raised.
Bay County, baby.
All right. So how does the neck feel now?
It feels better.
Good. Can you turn it left to right?
That was right to left, but.
It's the same thing.
Okay.
Depends on where you're standing. Up and down?
Oh.
Still hurts?
Mm-hmm.
When you go down?
Just like here.
Right there?
Mm-hmm.
Okay, cool. Just relax for me, okay? And you never been adjusted, right?
Mm-mm.
All right, put your palms on your lap. There you go. What you worry about?
I don't know. My hands are sweating.
Just relax, just relax. Just relax.
Mm.
It's called attitude adjustment.
My hands, they're wet.
With a YouTube
Yeah,
comment's gonna be
so
crazy,
good.
man. Let go. One more time. Just relax on me. Just relax on me. Just relax.
I needed that. Oh my God. It's working.
It's working? All right, so
Yeah.
put your head down and see how you feel.
Yeah. It's still there, but
Okay.
not there.
Not like I was? Good. All right, we're gonna do your shoulders. Right here. Just relax. Just relax, just relax. Lou, you say you got
Now
a...
you can crack that. Well, I mean, there's a moment. You said what?
You say you got a skincare line too, right?
Yes.
Are you promoting that or not?
I made the page. I made everything. I'm just I was moving and in the process of moving, so as soon as I get settled in, yes, I am launching. I will bring you guys some
That's what's up.
samples.
That's what's up. We love samples.
Okay. Pretty perfect.
Lou said I'm ugly.
No.
Want better gifts?
Wait, my bad.
Want better gifts? Look better. Let me get
No,
you.
I'm done talking.
Let me get you on your stomach, face down. Slide down for me. Slide down. Slide down some more.
Here.
Some more. There we go. Good. Just relax. Let your arms drop. Let your arms drop. There we go. How you feel? You still nervous, Lou?
Not really.
We got the worst part out of the way, right?
Yeah. No. You gotta do my whole back. Oh.
So this is called Flexion extraction.
Ooh.
This is gonna help with any disc issues in the low back. It's already clicking a little bit down there. Just relax for me. It's way looser now. Just relax.
Oh my God. Oh. You know how long I've been trying to crack up there?
It's not your job, Lou.
I'm sorry.
It's my job.
Okay.
Whoever bought you that ring, they could have paid for this treatment a long time ago.
I know. You know, it is my fault.
Just relax, just relax. Just relax, I got you.
Oh my gosh. What the hell?
Dang, Lou.
Oh my Oh my God.
You stress too much, man. We got you, though.
Okay.
Face down for me. Just relax. Just relax, just relax. Just relax. Well, you was all jacked up. We ain't missed yet. I'm usually missing, but now I'm like, dang. What's going on? I'm stop. She's gonna be a happy person now. We're making happy people today.
My lashes by the time I get up, you look like crazy.
Oh yeah, maybe. We knock off lashes, wigs. I thought about doing a video with somebody who put on wigs, and we could see like adjustment versus a regular wig versus after they wig. But nobody wanted to do it with me. Yeah? You sell wigs? Okay. So this table is gonna drop 3 times like this. Okay. Slide down. 1, 2, 3. Good. How we feeling, Lou? Good. On your side, face me.
My lash is sticking to my face.
No, it's still good.
No, it's not.
Okay. Oh no, it's not. It's not.
TikTok lashes.
It's right under there. There you go. Bend this leg for me. Just relax for me, okay? How we feeling so far?
Great. How do you have it?
Just relax. Hug yourself. Good.
Oh. Oh my God. I'm gonna sleep so good tonight.
Other side.
Oh, God bless your soul.
Do what I can. Jesus was a chiropractor.
Huh?
Jesus was a chiropractor.
Like, huh?
Straight. You ain't know that?
No.
Straight. That was a typo.
See, I'm so delirious I can't even think straight.
That was a typo. They said carpenter. I always tell people, you never heard about him pulling permits. Or anything.
No.
You only heard about him healing
He
people
wasn't healing. Oh.
with his hands. You don't get that. Cut wood. Well, depends.
Oh,
But
Lord.
anyways,
Yeah, needed that.
on your back.
Oh.
Want to take off your shoes?
Yeah.
Want to take off your socks? Your feet ready or not?
Yeah, man.
What you talking about? You see this ring?
Huh? Exactly.
There's money in here. There's money up there, y'all. All right, just relax.
Oh. Yeah.
All right?
Yeah. Thought you were trying to take off my foot.
You still there, right?
Yeah.
How'd you feel?
Good.
Good.
I don't like that. I don't like my toes being cracked.
Okay. Just go stick with the foot then. Just relax. Just relax. Just relax. Just relax. Just relax. Okay.
I don't be feeling that I'm 10. Oh my God, my back feels so clean.
Vintage. Come on. Swing your feet around. Stand on up.
Ooh. Mhm. Yeah.
How you feeling?
Good.
Ready to make some more money?
Yeah.
Now tell them what's the name of the skincare line?
Blue Ovis. It's coming soon. It means to create and finish in Dutch language.
Boom.
Boom. You get it?
Boom.
Blue Ovis.
Come on, man. Y'all not deep enough for the concepts.
Went over the head.
Over the head.
You're mad funny.
Just relax. Just relax. It's not moving at all. Try this other side. See what's going on. There we go.
Wow.
You are still very tight right in this neck area. You sure you don't got no stress, man?
Probably the way I sleep.
How you sleep? Stomach back or side?
Back inside.
Back inside? Okay, well, that's good. Straighten your legs out. There you go. Just relax a little. How we feeling?
Good.
Sure? All right, uncross. Let me have you, we're gonna do some stretching for your low back.
Okay.
Let me have you lift your legs up, grab your knees.
Okay.
Does that hurt?
Yeah, that's where the pain is. Like that folding is where it literally what hurts.
Now, does this hurt when I push down a little bit?
Yes.
Should we stop?
No.
All right. So we're gonna try to stretch out a little bit more. Let's lift this butt up a little bit. There we go. Push your butt down. Flexibility not bad though.
No, I'm very flexible. That's why this pain is excruciating.
Push, push. All right, relax. One more time. Come on, come on, come on, come on. All right, relax. Good. All right, let's have you put your feet down. Now I want you to have you do a hip thruster for me now. Let's see how you feel. There we go. Come up. Still pain?
Yes, a little bit. Yeah, like right.
All the way up there?
Yeah.
All right, let me have you lay on your side, face me. Bend this top leg, straighten the bottom leg. Hug yourself. There you go. Just relax. Are you good?
Yes.
All right.
Oh. Yeah.
You all right?
Yeah.
Forgot where you was, huh?
Oh, wow.
Other side. Straighten this straight, straight. There we go. All right. Let's have you bring this hip forward for me. Straight, straight. There we go. Just relax, man. That was a lot.
Yeah.
And you ain't never, see, that's what happened. You put all this pounding, all this work on your back, then here we go. You got these problems. So now we're gonna check your ankles. Any ankle surgery, anything like that? All right, cool. Just relax on. Just relax. Ankles feel kind of funny, man. Yeah, you feel it? right, let me have you lay on your stomach face down. All right, so now we're gonna do something called Shockwave. What we're gonna do is we're going to help break up some of that scar tissue. It's gonna be some electrical impulses. So, put your finger where the pain is for me. Right now?
Yeah.
All right.
Like that curve.
All right, you mind holding this right here for me? You feel anything?
No, not yet.
Now, is that where the pain is?
Yes.
Where? Let me know when I get to like the exact spot where it's like very tender.
A little bit lower. Okay.
Right there?
Yeah.
All right, cool. Don't say any lower. Don't get with some community guidelines. You want me to turn it up?
You can. Ooh.
Right there?
Yeah. Yeah. It's like a knocking.
Yeah.
Oh.
When it's on the fastest one, it'll shoot at you the entire time.
For real? See, I need mask.
Yeah.
All right. That is enough of that. Now we're gonna wipe you down and we're gonna do some grassing on this area. Oh. Is that over the area?
Yeah.
All right. Now we're gonna do some drops. I'm gonna have this table move up and down.
Okay.
And then we're gonna do some drops on your low back. Let your arms drop to the ground for me. This is called flexion distraction. This is gonna open up the disc in your spine. How are we feeling so far?
Good.
Any
Much better.
Much better?
Yeah.
Out of 10, where we at?
Well, right now I'm not in no pain, so.
No pain? Uh-oh.
I'm trying to see
Slide down.
what the back feel like.
All right. Let your arms drop. Good. You're really tight up in here too, man.
Yeah.
Jesus.
I can already know I got knots up there.
Yeah, you got a foam roll, man. Do you foam roll?
I do.
Not this area though, huh?
No, not my upper back.
Why not?
It's annoying because my hair always gets caught in the foam.
Ah. Bad excuse.
For that, I'll typically go get. Oh. Plus, I have like an 8-pack on my back, so like.
An 8-pack on your back?
Yeah, that's like literally why I just went viral because of my back on Instagram. So like, let me show you my phone.
She wants to show us a viral 8-pack back.
I'm not flex right now, but so I have like, I actually have like packs on my back if you like can see it, and they're like very prevalent. Let me see if I have a better video, but like, okay, this is my pull-up video so that you can see my abs on my back.
How did you get back ab?
I have no idea. I think I just lost enough weight so that they could be shown.
Maybe you're not human.
I believe in Avenger. I need you in my life.
No 8-pack though. But you know what? I mean, somebody with an 8-pack back would definitely need a chiropractor.
Yeah.
Your neck is stiff. Just relax. Just relax. All right. So we're just gonna have this table drop down. Just relax. Good. Good. Sit on up. Just relax on. And cross your legs. Just relax, relax. Just relax, just relax. There you go.